Welcome to the program. I'm Jeremy Fernandez. Coming up, we look at the risk of COVID in children under 12. But first, New South Wales has seen its deadliest day. 12 lives lost to COVID, including a woman in her 30s who died just one day after being tested. The state recorded more than 1,400 cases, and Premier Gladys Berejiklian says the next fortnight is likely to be even worse. The message from all leaders everywhere remains the same: get vaccinated. And to help with that, the Prime Minister has announced Australia will receive 4 million Pfizer doses months earlier than expected after a major vaccine swap deal with the UK. Let's get more now from Casey Briggs.
Well, Jeremy, these Delta outbreaks that we're seeing across the country, they have a lot of similarities about them. First, we've got, of course, the big New South Wales outbreak, more than 1,000 cases a day, every day virtually now, and this trend is still going up, spreading largely through essential workers and their homes. That's been one of the big drivers of spread in New South Wales. In Victoria, we're seeing a big escalation just in the latter part of this week. 208 cases on Friday, and we'll be in the double digits just a few days ago. And what we're seeing there is increasingly more mystery cases rearing their heads, and they're increasingly being found in the western suburbs and increasingly the northern suburbs as well, dominating this current outbreak. And a big driver of transmission there, it's essential workers and their households. What I want to do is show you the cumulative sizes of these outbreaks at the equivalent point that they're at through time. I've put these on a logarithmic scale because it's a bit easier to compare them in that way, and I've included the Victorian second wave last year just for that context of what the big outbreak that we have seen in the past. And this New South Wales one, it is bigger now and it is continuing to grow at quite a pace, 25,000 cases and counting. And what's interesting to look at is the early days of New South Wales compared to this Victorian wave. It's a bit hard to kind of know whether to count the two Victorian Delta outbreaks that we've seen as two or one, lockdowns 5 and 6. But for this purpose, I've just counted them together, and we saw some rapid growth followed by a flattening in the initial curve and then this takeoff again in, Western and Northern Melbourne, 1,850 cases to date. And the slope of the New South Wales and the Victorian curves, well, they're pretty similar, suggesting a pretty similar rate of growth. And then there's also the ACT outbreak, considerably smaller, just 328 cases so far, but still a lot of community exposure. And still, and we're seeing the initial stages of that ACT outbreak, they look a lot like the initial stages of the Victorian one and the New South Wales one. So hopefully this ACT curve does flatten, but so far it's looking a lot like New South Wales did, Jeremy.
Casey, thank you. Well, the Queensland Premier, Anastasia Palaszczuk, has doubled down on her call for more detailed modelling on children before deciding on when and how to open up her state. Earlier this week, Ms Palaszczuk suggested changing border restrictions would be too risky for unvaccinated children under the age of 12.
There is a very legitimate conversation where I'm asking questions about what happens to a cohort of young children who aren't vaccinated. These are legitimate questions that Queenslanders and Australians want answers to.
So let's dig deeper onto this issue of the risk to children. Philip Britton is a Paediatric Infectious Diseases physician at the Children's Hospital at Westmead in Sydney. Dr Britton, what do you make of this call for revised modelling on the basis that we just don't know enough about the impact on children?
How severe is SARS coronavirus type 2 infection in children, or COVID in children? I think we've got a pretty good handle on that. And then secondly, what are the impacts of the wider COVID world on children? And that includes things like lockdowns and other elements of the public health response. I think we've got a reasonable handle on that. And if I was to put those two things on a balancing scale, and which is causing the bigger problem in children at the moment, I would say it's clearly the impact of lockdowns, school closures, loss of social connectivity. That impact is much, much greater on children at the moment than the infection itself. If I was to focus particularly on severity of disease from the infection, I think the news is hugely reassuring. And by that I mean 95% of children who have this infection have a mild illness.
Is it not the case, though, that low case numbers in kids is a product of the lockdowns, and so the concern is if you lift these measures, the cases will skyrocket?
Well, again, the language is important there, Jeremy. I do think it is a truthful proposition that as we see more mixing of children, the infection is likely to transmit between children at a greater rate than we see in a lockdown circumstance. Will those rates of infection skyrocket? I think that's a word that I wouldn't use. So I think they will increase. But will the relative risk of severe disease increase? No, there's no evidence that that's likely to happen. We are still going to see 95% of children with a mild infection. And then even amongst the 5% who get more unwell, the vast majority of them are going to respond relatively well to simple care, low-level type hospital care.
Now, you treat children with COVID. What is it like for kids and parents who fall ill at either end of that spectrum?
We are dealing with many hundreds of children who have this infection in their homes. And the biggest difficulty we're facing is actually that their parents are getting very sick. And when their parents are getting very sick, sometimes going to hospital, sometimes in two-parent households, both parents going to hospital, we're left with relatively mildly unwell children, but no care. That is the actual biggest challenge at the moment. Within that, across the childhood age range from 0 to 16, most children will have maybe a fever, a cough, a runny nose, some sore tummy, be off their food or feeds for young babies for something like 3 to 5 days. And then they'll get better. It's a very common story for us to call a household and mum or dad to say, I am feeling sicker than I've ever felt. But the kids are running around and playing with one another. We have seen a small number of children, and we're talking amongst hundreds, now over 1,000 infections in children that we've been involved with. We're seeing a handful of children where the chest infection is more severe than that.
Now, a lot of parents would naturally wonder, what if they're the unlucky ones? What's your best advice to parents on how to manage that?
As a parent, I really want parents to start to think about how do we give some positive messages around COVID to children, which is most children at the moment are not getting this infection. Most children who get the infection recover without any issues. If you get the infection and you get sick, there are doctors and there are hospitals who want to care for you, and you will get better almost always. Kids need to hear that, because I'm really worried both that kids in society in general and kids who get the infection, their first thought may well be in the current atmosphere, am I going to die? Or is something terrible going to happen to me? We need to, as adults, say, no, you are going to do well, okay, even if you get this infection. But in advance of that, we're going to think about getting you vaccinated when the vaccine's available.
Dr. Philip Britton, thank you. Amanda Goh is a clinical psychologist as well as an educational and developmental psychologist. She joins me now. Amanda Goh, there's a lot of concern, isn't there, among parents and kids about how to re-enter normal life. What's your best advice?
It's going to be a big change for them. They're just so used to just being at home with their family members, and shifting from that to just going to school where they're accustomed to, mixing around with teachers and students again. It's going to be a big challenge for them for sure, because I think one of the bigger impacts would be, they'll be socially awkward. They need to be retaught social skills, how to ease back into just life, being with friends, to look beyond their self-interest. Particularly, I'm just thinking with children with social anxiety or even selective mutism, they would have to be pushed, to go out to actually interact with people, because they've been so used to just staying at home. And in fact, they have the extra 2 years to be at home, to be home-based learning.
Kids are very tactile as well, particularly at younger ages. What is that re-entry into school going to look like when there are going to be all these new social rules about what they can and can't do?
Yes, no, that's a really good question. I think kids will be really excited. I've spoken to families from different countries who have kids re-entering school, and with all these new restrictions and a mask on, being told that they can't, high-five their friends or touch their friends or being too close to them. It's hard because they have not seen their friends for quite a long time. They're excited to see them. They just want to rush to them and just, feel them, touch them, and do something fun with them. And you think about a lot of games that children play. It's a lot of, running, catching. So yeah, I think that'd be a big challenge, to be telling them, no, they can't do this. Yeah.
We have particular dates around borders reopening, kids restarting school. What if those dates cannot be met for whatever reason? Vaccinations, don't keep up to time. Is it important that people sort of look beyond the due dates?
Yes, I've been telling lots of different parents and family, those who are older children as well, like to just really not overemphasize or even over-glorify what life would look like once COVID passes or once you're back at school, because it just highlights again and again how challenging and difficult our lives are currently. So instead of focusing and counting down to that day, I think it's really important to just focus on the simple little joys that we all take for granted, setting realistic expectations for yourself and the children, realizing your productivity levels will be different, the progress of your children's learning will be different, and, it will not be as you expect, and it's okay.
Amanda Go, thanks so much. There's been a lot of misinformation about COVID-19 vaccines, and there is one rumour that's been circulating about the Pfizer vaccine. Joining us to talk about this is medical reporter Sophie Scott. Sophie, what incorrect information has doctors so worried about the Pfizer vaccine?
Yeah, look, you're right, Jeremy. There's been a lot of misinformation circulating, and one rumour in particular has been getting a lot of coverage in social media, and this was a rumour and misinformation that the Pfizer vaccine had anything to do with infertility in women. And the reason, and it's absolutely not true, we need to be very upfront about this, that there's no truth to that rumour whatsoever. The reason it came about is because there was a false report on social media which linked there's the spike, the spike protein that we talk about all the time that the vaccine encourages you to make when you have a vaccine for COVID. There's a spike protein, but a different one that's involved with pregnancy, and somehow this got put together as being the same thing. They're completely different spike proteins. And that's where the misinformation came about as a result of this social media post. And it spread very quickly and got picked up really quickly. And it's absolutely not true. There's absolutely no impact on fertility for anyone, for men and women, or young men and women having the Pfizer vaccine. In fact, we know from the studies that were done on Pfizer, when they did the trials of people getting both the vaccine and the placebo, that there were 23 women that actually got pregnant accidentally when they were in the trial. And the only miscarriage that happened was the woman in the placebo group. So from that, they can tell that it's very, very safe. And so, yes, we've had to have authorities coming out this week. The New South Wales Health Authorities came out specifically addressing this rumour to say that there's absolutely no link between fertility and the Pfizer vaccine. It's completely safe.
Sophie, what's the scientific data telling us about the vaccines and women who are pregnant?
Yes, look, all the vaccines, all the evidence shows that it's very, very safe. And ATAGI, which is the government's expert panel, has come out and recommended that pregnant women and breastfeeding women are offered the vaccine. So there's been an issue with supply, which luckily is getting resolved, because for a while a lot of women wanted the vaccine when they were pregnant and weren't able to get it. But that's actually getting a lot better now that we're getting more Pfizer vaccines every day now, which is fantastic. So yes, the advice is, if you are planning to become pregnant, if you are pregnant or breastfeeding, you're much safer, and all the evidence shows you're much safer to have the COVID vaccine than if you get pregnant. The side effects can actually be quite severe if you get COVID and you're pregnant. You're seen as a high-risk patient. So it's much better to be protected from that illness. And even down the track, Jeremy, when more of us are vaccinated and there is more virus circulating in the community, it's still going to be important for those vulnerable groups like pregnant women to be protected, because they are seen as a higher risk group. So yes, it's going to be something that it might even be one of those things that's included in the standard when, if you're thinking of becoming pregnant, you should think about getting this vaccine. So it will be something we'll be hearing a lot more about, and it may become part of the standard sort of prenatal care that women have.
Sophie Scott, thank you. And that is the show for this week. Bye for now.